change our program. And we, in that sense, will move forward our student presentation. And I'm introducing this as a kind of a separate thing, that frequently these academic conferences are just places where we professors come together and we talk to each other, talk at each other. Sometimes we have conversations, and we make these events available to students to listen, but hardly ever to participate in. And I thought that it would be a nice gesture to bring in some of the students who also work on issues that are linked to biopolitics, although not strictly speaking on biopolitics. So I have student members in my research team. One of them is MA student Lina, who is going to speak today, but she has been working with two other young people from what is called the Talents to Tartu program, BA students who helped sort of mine data, first gather data and mine data in order to basically within the bigger project, which is about how crises are represented in the media. And of course, COVID has become this super crisis that has eaten up all other crises. And Lina will attempt to give you the sort of big data picture of what goes on, unless this was Johanna Oksala saying that she's now online. No, no, it isn't her. So, Lina, we kind of try to have her presentation as our little conduit between Marge, who already talked about media, and then our discussions that wrap up the evening later on.
Yes, good. So this presentation introduces one result of the research that the student team I, Susanna Mett, and Georg Kaldvee have been doing within Professor Smalling Estonian Research Council grant on the representation of crisis in the US, French, and Estonian media. For the past year, we have been working on the representation of COVID-19, as this crisis has overwhelmed all others. For this presentation, we focused on certain keywords that have emerged in debates about COVID. So let's go inside our heads according to the media. Firstly, I will briefly explain how we gathered our corpora. It consists of articles published by Le Monde in France and the New York Times in the United States of America. To compare how the representation of the crisis has changed over time, we chose two time periods: March 2020 and October 2020. After processing, we got a total of 4 text files. You can see from the picture how we filtered out all articles published in the selected time period that contained the keyword COVID-19. Why we chose COVID-19 was because it works in all search engines. For example, corona and coronavirus gives different results. On the right, you can see the size of the corpora by the number of words. Interestingly, for both newspapers, the corpus in March is larger than the corpus in October. So let's look at the background of both countries at that time. You can see the increase and decrease of the number of confirmed cases. Each grey stripe represents 1 week. The drawn boxes point out the time periods observed in our study, March and October. In both countries, the number of confirmed cases was either very high or rising, which is why it's interesting why the coronavirus was no longer a popular topic in October. To take a closer look what was being said, I made 2 word clouds of the most commonly used words. The more often the word is used, the bigger it is. There are no major changes in France, but some issues have come to the fore in October. Well, mostly we can see still in March, COVID, epidemic, day by day, what the government says, health Sunday, and it's almost the same in October. But what we can see is the president. What president has come up? I will come to that later. In the United States, on the other hand, it can be seen that in October, issues related to the presidential election dominated. Mr. Trump is literally bigger than pandemic. And that's what dominated in October. If we looked into a corpus, it was Trump, Trump, Trump all the way, even though the numbers were rising quickly. To look deeper into the text, we used Co-Occurrence tool in Hyperbase. And I want to specify that I specifically chose tools that are really easy for everybody to use. You don't need to be an IT scientist in R or Python. I'm definitely not. But to help you in a case when, for example, you have a lot of text you need to analyze. So what is a co-occurrence? Co-occurrence is an above chance frequency of occurrence of two terms from a text corpus alongside each other in a certain order. The tool displays the distance of the words depending on how frequently they appear in the same span of text of a certain size. The colors represent the clusters of words, always established thanks to the co-occurrence. So in this example, Le Monde in March, we see some clear thematic clusters. For example, the waiting for the decision cluster, the pink. The virus and medicine cluster down there. There's malady, sickness, medicine, hospital. The business cluster, and you can see up there how far is the sickness and business. They're always in opposition to one another. And the cluster of verbs. For example, we need explaining, we need to know something, all of what co-occurred. At the same time, about the same clusters can be seen in America. It's interesting how the health and entrepreneurship in both pictures seem to be the opposite. And that was our choice. Either we choose business or we choose health. So the visuals are getting really hard to read, but what I wanted you to see, those words that are really far away, million, euro, milliard, how far are they from everything else? They were really distinct and are really far away. That means they were not connected. For example, in the crisis and in the health, they were almost like a separate thing. We don't put them together in the newspapers. That was really interesting. And also the mask thing, it's, yeah, you probably don't see, but I will move with it. So over here, the masks, the decision, should we wear masks, who wants to wear masks, came up in October. Yeah. In America, however, there are new topics in October. A large part is the presidential election, obviously, then the opposition of home and work. But up there you can see the topic of school and children are especially interesting because it's, again, so far away from others. What will happen with our children's education? Parents unhappy with the remote learning. Are the schools open or closed? So the crisis of COVID, crisis wasn't COVID, but crisis began to be education, crisis began to be, I don't know, can I work when I'm ill, etc. So the definition of crisis always changed. To take a closer look at these issues reveals the confrontation. What are our rights and what are our responsibilities? So in front of you are the keywords and the number of occurrences per corpus. Each black line indicates an occurrence. A stronger line indicates that there was more than one mention. And let me remind you that the number of words in both newspapers decreased. Therefore, it's interesting that the number of occurrences of keywords increased in October. For example, droit, rights, 135, droit in October, 117, although corpuses went smaller. It can be assumed that while everything was just beginning in March and the whole world was trying to cope with the situation, in October we were already thinking more deeply about our role. It can be seen that both rights and responsibilities increased. In the case of the United States, we can see how everything fell. No liberty, literally. We didn't mention liberty. Only 7 times. Less rights, less freedom, less responsibility. So let's go even deeper into the keyword level to understand what changed according to the press. The horizontal position shows which collocation is stronger, whether with the word on the left or right. So for example, what goes together with the word droit, rights. On the right part is March, the green part is October. And it almost seems obvious, perdre, to lose, are we losing our rights? Somebody has to guarantee us rights, we have to defend our rights. Someone is violating maybe our rights. But if you go deeper into the word, then you see it's actually not that. For example, televise, to broadcast, it wasn't about COVID. All the text talked about COVID, but it was on the side. It actually talked about football. We need to broadcast more football. It's a crisis. So, literally. According to New York Times in March, one had to uphold, expel, revoke. In October, one defended and ignored the rights at the same time. So data showed that there was a lot of controversy in October. In the view of the presidential election, it was essential to vote for the rights. But again, if you go into and look what these words actually mean, yes, there were topics that talked about COVID directly. For example, exercising the right not to work when ill. So it was about work. Defend the rights of all people, even those whom we might disagree. But at the same time, defend the federal right to abortion, not COVID, but right to have an abortion. So in October, again, what dominated? Right to have an abortion. So again, another topic that kicked in. Forfeit, Ms. Harris saying Mr. Trump and Pence had forfeited the right to re-election. So we can talk about what's the responsibility as counterweight to rights. I took a closer look at what the press said was our responsibility. It looks like it has been forgotten or rejected, and it had to be broadened. Then in October, it was denied or fuir, we fled, we didn't want it. But actually, when they talked about responsibilities, they didn't even talk about France, they talked about Trump. So even France didn't talk about France, literally. Trump was the main topic when we're talking about responsibilities. And for example, when we talk about nier or fuir, they were talking about that Trump is denying responsibilities or escaping his responsibilities, according to the Le Monde. In New York Times, at the same time, responsibilities should be borne, accepted, or we feel the responsibilities. At the same time, for example, some people escape the responsibilities or juggle. We should maybe manage it better. But if we talk about what we should bear, we talked about Italy and Europe allies still bear the responsibility, or Trump bears the responsibility, or China bears direct responsibility. We talked about who else bears something. So if we talked about acceptance, then it was negative, that Trump never accepts responsibility. So again, nothing literally about COVID, but about something else. So in conclusion, digital humanities can help to look for patterns that may go unnoticed when reading. I believe that 20% is digital, 80% is humanities, which means that data must be interpreted. But the data helps us understand if our gut instinct was correct. I remember the quote from yesterday's presentation that I specifically really liked and I would like to use here as well, that the end begins before you are even aware of it, it passes as ordinary. COVID crisis is everywhere. There were a couple millions of words in our articles that contained COVID, but actually COVID was always on the side. The COVID is there on the side, but life must go on, so it wasn't actually about COVID. We feel like it's everywhere, but actually the crisis was something else. So that's why it's good to have proof, and digital humanities can help to go inside the text, even though you are feeling that you must certainly know what's happening. So thank you very much for listening.
So I can take questions and comments because, of course, I'm going to just say that I find it very compelling, of course, that in some ways, you know, the issue of what we talk about during crisis is not the crisis necessarily, because it's not news anymore, right? And it just becomes hum at the back of our heads. And I think that's what the data showed, right? Yeah. So does anybody have any questions? Okay.
Just a simple question, is the project finished now, or are you planning to continue this in some way?
This is my master's thesis, so we are definitely going to continue with it. Yes.
Yeah.
Right now we have March and October. We have the full Le Figaro. We actually have 6 newspapers. So the hard thing is how to get the data. You actually have to get it somewhere. You can't just copy. For example, in New York Times, in March, there were 1,200 articles. You have to have a code to actually get them. You have to clean them. For example, if there are words like published in, you have to clean those words so they wouldn't mess up the data and wouldn't give false ideas, for example. Yeah.
Because I mean, that's the hard part of this work, that we are in that copyright protected environment. In other words, that it's somebody's intellectual property and you just cannot download it like you can public media like Twitter. Like there are lots of Twitter corpora because they are all in, you know, already online, whereas what's behind the paywall is behind the paywall. And so you have to somehow hack the system. Yes. And of course the content provider is not that interested in giving away all of their stuff for free.
I must say it was quite scary. Like, of course, yeah.
Sorry, as far as I know, the National Library in Paris records all the publication. So is it not possible to get access through the National Library then?
Well, every newspaper and in every country the rules are different. For example, in Estonia, we live in Estonia, it would be really easy to write them and we are doing a research, can you please help us? They don't reply usually. If they are sharing something, then usually they want something in return. So it's a good idea to write to them, but right now we have one user, what we are paying for the reading. Yes, we are legal subscribers. I'm a paid user of all of the newspapers. Yes. But they get suspicious when somebody downloads 9,000 articles. Right? Yes. That's suspicious. If it comes from the same IP article and you just do a mass download. Yes, if after 5 seconds you hack the servers, but actually I have bought the license. I can read those newspapers. But if we're talking about, for example, 1,200 articles for New York Times, it's almost nothing for them. So the data actually isn't that big, but of course, if we're talking about, I don't know, a couple 100 millions of words that are regular size in this kind of research, then of course you have to talk about how can you, for example, distribute your data? Can you? For example, we are not sharing articles, we are sharing only the words that I have found, but you can search them with Ctrl+F as well. Of course, it doesn't give you the results, but everybody has the possibility to read it. But we are not sharing the whole article. So that's why we are not in the danger zone, let's say it like that.
Yes. Thank you very much for an interesting presentation. I'm Barbi Pilvre. I arrived a little while ago from Tallinn University. I've been a journalist and a researcher also, and will be part of the panel. But now I wanted to ask, what about the similar research on the same topic? Actually, are there in the relevant countries maybe some researchers? Do you have any contacts? Or probably they have not published yet because this all is very new, but maybe some research is being done.
Of course, in digital humanities, these kind of methods have been used, of course. There are a lot of them. And as you said, COVID is relatively new, but new articles are coming every day and week. When I started, there was almost nothing because it was so new. For example, when I started, it wasn't even the end of 2020. So yeah, that's why, for example, the October wasn't even there. So first it was March and it was like nothing. Now, yes, I can't give you a specific title of any this kind of research, but I know that, for example, in Tartu University, there have been studies how to get the data from newspapers.
One more question. So you showed us very nicely these sort of variety of topics and the shifting focuses and that made me interested. And so I think, do you have also any methods and plans to explore the factors that are behind these movements? So what makes, in a certain discursive context, a certain topic at a certain time important and more prominent?
Of course, that's the whole point of it, to explain why something happened. If you just give somebody keywords, it doesn't say anything. The aim is to actually look back and understand what happened, how much it took for us to almost forget the crisis. It was less than 6 months, then the crisis wasn't crisis was football, that we couldn't watch football. So, of course, if we have the whole corpora, if we have all the data in the format that we wish, then you can start looking back at the exact time. Okay, here we can see these words coming up. Why? Here we can see these patterns, because what digital humanity gives you, it gives you patterns that may go unnoticed, but it needs that everything has to be cleaned and done before you start digging what's happened.
Yes, thank you very much, Lina. What I find very interesting about this is that you had this comparison between two different countries, and we saw that quite a few differences were there in focus and in interest and really how people perceive that. And I think that's a very interesting indication again for what we have come across before, that every crisis is a created event in some ways, yeah. And of course, in every country as well, the curves and so on, infections and the virus as such also was present in different ways and at different times and so on. But I think we can see again how somehow everything is also an issue of discourse in this way, yeah? And it's very interesting to have those kind of research patterns to see that that is indeed the case, and that we always construct a general perception of crisis. And if all the newspapers focus on that topic at that point of time, that creates a very different perception of what is really going on. Or the question is, what is really going on if we talk about that and so on. Yeah? So there are lots of follow-up questions if you have this kind of statistics. Yeah? So what is really behind that? Not only what kind of event, but what kind of historical situation, what kind of cultural tradition, what kind of interest that leads certain media to focus rather on this instead of on that, and so on and so on. Yeah? So it's endless. But there are lots of potential in that.
I agree.
So I think we have exhausted the questions and comments. So
There was one question.
Oh, sorry, my bad.
Yeah, I also found the presentation very interesting. About the vocabulary you showed, you said that sometimes they were related to other topics than COVID. So do you think that the usage of this vocabulary was still linked in COVID, for example, in a way that, for example, journalists expressed some kind of thoughts or feelings related to COVID they had through other topics? Or do you rather think that maybe we, as we look at the words now, we relate to them thinking about COVID? So to say that we think that maybe the media wrote about COVID or about these I don't know, atmosphere of COVID in a way, although they were writing about other topics, or do you think it's a bit of both, or, yeah?
Of course, it's a mixture. Of course, we have to look at through the media filter, but media writes what happens in the world. I want to add that one thing, what that was really interesting is, for example, you see that if you click on the co-occurrence and you open it and you see the same text, and I thought, okay, should I clean it? Is it bad? But then if several journalists, for example, 10 journalists, copy the exact same phrase of Donald Trump, there must be a reason why they're copying it. So I left it in, because if we talk about it, it must be interesting. Not interesting, but important, let's say. So, of course, we have to understand that there are filters and it doesn't tell us everything. Yes.
Just to add to the vocabulary question, actually, the one thing that you could also see in the clouds a little bit is that we tend to focus on those keywords like droit and freedom and things like that, but there are lots of interesting patterns with grammar and grammatical words, like like for example, the use of Mr. is not interesting in New York Times because they use Mr. for everybody, but sometimes you find out lots of stuff about, prepositions and small particles. Do we call them particles? Yes, okay. Like grammatical features that tell you a lot about events, and I think we haven't found a good way of finding out whether for normalizations are being used or some grammatical structures that also shape people's perceptions, because it's very hard to search for them. As you know, computers do things that you tell them to do, and it's very hard to write good algorithms or formula for catching interesting stuff. That's why I think Liina's conclusion about qualitative work is really important. In Estonia too, there is lots of hope that we will get these big digital answers. We'll have data, and data will tell us. But the data doesn't tell us anything. We need to look at the text and sort of qualitatively take it apart. So that's what's interesting about this. Okay, Marke. Yeah. Right, exactly.
Maybe one comment just about this coronavirus actually not being central in the corpus, but it was one of the interest of this ideas in getting this corpus that actually, because we look for, but we search by word corona, but if it appears in not in central in topic, it's even more interesting. Yet in what context comes up? This is discursive context is corona, but in what context and so on? Well, corona appears everywhere, and it's even more interesting if it's not central, but it's it was this is the first idea we'll get in corpora.
Just in case, when talking about the grammar and those like small words, I have to mention that the corpus was lemmatized, because when the corpus is only 2 million words, it's too small to actually look for really specific words, and only those. It might not be enough. Because, for example, if you have only 10, 20, 30 small keywords, it might be a coincidence. You have to have much more. So if we lemmatize, then yes, you get one lemma, like a lot of it. But if you look, for example, only one form of, passive, and you have only 8 occurrences, it doesn't say anything.
Yeah, it's interesting that the word becomes kind of viral itself, so, and when it starts to appear in every context, so, which is also not related. But I want to, it's just a curiosity, you said that you decided to look for COVID and not Corona, but still, have you noticed when Corona becomes COVID? Because at the beginning it was always Corona, and then at a certain point...
Yeah, we almost had a joke about it, that it didn't took even about 2 or 3 months until we get the cute version of COVID, the name Corona. So I think in the spring, even I can't give you a specific date, but it didn't take 2 or 3 months even.
That was very complicated in terms of search, because we also tried to do an Estonian search, but the Estonian papers are just too small. The data is not big enough to say anything. It's it's very strange as to what kinds of stuff was not written about. The cultural patterns of what was written about are very, very interesting, but that's for the next conference. So, and we'll wait for Lina's thesis.
Oh. Thank you very much.